As the country inches towards a full year since the outbreak was first confirmed, President Cyril Ramaphosa has eased those lockdown restrictions from level 3 now on level 1. In his address last night, Ramaphosa said with South Africa's vaccination program now underway, he's optimistic that the country will overcome the global pandemic. About 67,000 odd healthcare workers are now being vaccinated and counting, while a second phase of the inoculation campaign will see the elderly and people with comorbidities also receiving their shots. Let's get you some perspective about what we ought to be thinking about now, bringing Dr. Aslam Dasoo. He's the convener of the Progressive Health Forum. Doc, thanks very much for your time and welcome to the AM report. I wonder whether you worried at all about the timing of yesterday's announcement, given the fact that we haven't actually even moved past allaying fears about the third wave as we approach the winter season.
Good morning, and good to be with you. Yes, look, of course, I think the anxiety remains. We've been here before, and listening to the President last night, one certainly gets a sense of déjà vu in this situation. Taking us to level 1 the last time, coincided with a great degree of complacency among people who naturally felt much freer to move around and congregate, and we had several super spreader events that led to that second wave. And of course, this is now a major concern. I think we start on the basis as clinicians and scientists, with the science that says, the gold standard is congregations of more than 10 people represent a major risk. We have, in this situation, one notes that they've increased the number of people allowed at certain events, doubling the numbers that were in place, and I think that will come with a corresponding risk. The regulations themselves remain, by and large, punitive. I mean, it's very difficult to understand how keeping a curfew between 12 and 4 is going to help in any way. Of course, opening up industry like the alcohol industry with its upstream and downstream elements to it is good news for those businesses and workers. One is a little bit perplexed about the tentativeness around the tourism industry, because the tourism industry with guests, particularly from abroad, seems to be having quite a handle on how to manage things. So there's a disconnect in my view with a lot of the regulations moving to level 1 and our situation as far as the epidemic in the country is concerned.
Yeah, speaking about a disconnect, in fact, the sentiments expressed by the President yesterday is that there is now a clear path towards bringing infections down and, in fact, defeating the pandemic. To what extent does that resonate with you, though?
Well, look, I think epidemiologically we can't talk about this as a war and taking on a virus as though it's some kind of enemy. The virus doesn't really care about us as an enemy might. So defeating the pandemic would mean, as I understand it, getting us beyond the emergency phase of the pandemic, which is, of course, a very important objective to reach, which has certainly been boosted by the start of vaccinations eventually. And I think that must be the focus right now. There's a very strong likelihood of a third wave because we won't get enough vaccine and vaccinate enough people by the time the change in season occurs, which is when that third wave is expected. And so this reinforces the view that right now what we should be doing in this lull that we are experiencing is, number 1, scaling up the vaccination drive. Number 2, securing and putting in proper infrastructure into our public healthcare system, which has to deal not only with this very ambitious vaccination program, but which has to be fortified in preparation for the wave to come and perhaps even more waves to come. And so I think that focus must be, it must be relentless. I'm not sure that it is. We'll see in due course. And then, of course, lastly, the populace needs to be clear that going to level 1 is no reason to reduce the adherence to the very important non-pharmaceutical interventions we all know about. Fortunately, the level of compliance has been reasonably good, but one hopes that moving to level 1 doesn't make people feel that, we don't have to do a lot of the stuff, which will be a disastrous situation for us.
Yeah, speaking about disaster situations, still a lot of apprehension about whether or not we're able to actually meet our target of getting so-called herd population immunity, whatever you want to use, before the end of this year. If the health department's figures are anything to go by, 70,000 odd people have now been inoculated over a span of just over a week. Are we moving fast enough?
So let's just put this in context.
Yeah.
You are aware that we did receive 1 million doses of AstraZeneca vaccine, which had to be swapped out, and that's a whole story by itself. So the vaccination drive began on time because we were fortunate enough to be able to get the J&J vaccine in and start to inoculate health workers. Of course, because it's operating under trial conditions, we can't roll it out at a greater speed than currently what we have right now. With 80,000 shots coming in every week or 2 weeks, you can only keep up to pace with that. So it's a real concern that we don't have a full-on drive immediately. It is clear, of course, that we are not going to be able to reach population-level immunity by vaccinating 40 million people by the end of this year. And I think even the budget, which was revealed by the Minister of Finance last week, shows that the budget for vaccine acquisition is actually spread over 2 years. So they may have a realization that we're not going to reach it this year, that we will be vaccinating still into next year, and that's how the budget has been structured. But that needs to be communicated very clearly, because people still live under the apprehension or the misapprehension that we are going to be, fully vaccinated, sufficient to give us herd or population level immunity by the end of this year. That is not the case, and we're not going to be able to do that.
Yeah. I wonder, Dr. Dasoo, whether it's too soon to start asking questions about the next generation of COVID-19 vaccines. We know part of the limitation with the current candidates that are being rolled out is that they didn't necessarily factor in the idea of some kind of mutation taking place, and we're seeing this as becoming a whole lot more of an issue than it was at the beginning of the pandemic. What are you able to tell us about, the vaccines that are able to finally tackle this newly found problem in our fight against this virus?
Okay, it's helpful to just give this context, that vaccine science has made a quantum leap in its development over the last year. You've heard of Operation Warp Speed and so on, where vaccines that could take 10 years and longer to develop have been developed in a year. This is very good news in the age of pandemics that we are entering. So the vaccines on offer right now, the J&J vaccine has had good reports, and it's a single shot, so it's very convenient. And we do have about 9 million on order, although yesterday Johnson & Johnson reported manufacturing hitches. Now, this is not surprising given the demand for it and the limited supply around the world. I think this is the case with almost all the vaccines. And it's really about how much we as a country can acquire in sufficient time. All of them do work. It's important for people to understand all the vaccines work. They'll work, to differing levels, and in different contexts will have greater efficacy. As we know, our variant in this country is quite resistant to some of the vaccines, and that's why the Johnson & Johnson option works for us. But this may change, viruses mutate naturally all the time, and a mutation could emerge somewhere here or elsewhere with a variant that allows it to escape even the current vaccines that are effective. This is exactly what happened to the AstraZeneca vaccine, which had shown great efficacy to the precursor virus, but reduced efficacy to the variant. And this is a scenario that we face. There's just no getting away from this. However, to come back to my first point about vaccine science, it seems much easier now for manufacturers to be able to tweak the vaccines, retool them to meet these variants. It does take a little bit of time, but certainly not a year or 2 years as would be the case before.
All interesting insights. Thanks so much for taking time to explain this for us. Really appreciate your making time here on the AM Report. Dr. Aslam Dasoo is the convener of the Progressive Health Forum. Doc, thanks very much indeed.